Healthline viewers. This is your host, Varsha Singh, coming to again another episode of Saathi Special Series on TVASIA Telugu channel. We call this show Healthline because this is your healthline where you don't have to call, you don't have to make a phone call. We bring you the specialist, we bring you the subject matter experts who will share very important information which is all about your health. All those questions you may have in your mind that you always wanted to ask, maybe they are answered here. So thank you for watching this show again and being with us like a loyal audience. We love to see you every time we bring a new and special guest in Healthline, a TVASIA Telugu channel show which talks about health information and brings specialized physicians, healthcare providers who can share their experiences and information with you. You have watched many episodes of Saathi series. Saathi, South Asian Total Health Initiative. This is a group of physicians and healthcare providers who are researching, collecting healthcare information, health preventative information for you to improve the life of community members so that they can stay healthy and enjoy their life. Today, we are discussing a very important topic, a topic that is close to everyone's heart. In our studio today, we have two very special guests with us, very experienced and part of Saathi. They bring their expertise for women. So let me introduce DR.Juana Hutchinson Coles. DR.Juana Hutchinson Coles is a board-certified obstetric and gynecology. She is the fellowship-trained and board-certified female pelvic medicine and reconstructive surgery and urogynecology. She is also a proud member of New Jersey Black Women Physicians Association, which is a network of women physicians who are dedicated to advocacy and elimination of healthcare disparity within communities of color and other vulnerable population. She is also a member of New Jersey Medical Association and National Medical Association. Our second guest, Dr. Gloria Bachamann. Dr. Gloria Bachamann is also a national and internationally recognized physician who has moved healthcare to the next level in many areas that include women's advocacy, menopause, perinatal issues, and obstetric safety, sexual health, LGBTQ wellness, diversity and inclusion initiative, One Health and gynecological pain syndrome. She is a professor of obstetric and gynecology, associate dean of women's health, and director of Women's Health Institute at Rutgers Robert Wood Johnson Medical School. In addition, Dr. Bachamann was just appointed medical director of the Proud Gender Center of New Jersey and a committee member on the New Jersey Women's Commission on Re-Entry Services for those who have been imprisoned. She is a respected clinician, a faculty member, and a member of Saathi for a long, long time. So please join me in welcoming these two distinguished physicians on our today's panel, Dr. Hutchinson and Dr. Gloria Bachamann. Welcome, Dr. Bachamann. Welcome, Dr. Hutchinson Coles.
Thank you.
For both of us, I can tell you that we are thrilled to be with you and share some of our insights into aging gracefully. And let me begin the conversation by actually relating to everyone a patient who I saw today, right? This time frame.
Thank you, Dr. Bachamann. I think you just started talking about something which is happening today, and our viewers cannot wait to hear because we really want to know what's happening now.
Well, I want to give you one example of aging gracefully. I saw a 90-year-old woman who came in for routine care, and said to her, "What is the secret to aging gracefully?" And what she told me was, every morning I get dressed up as if I'm going out to something special, to a special party, to a special dinner, to a special friends or families. And she said, that's what aging gracefully is all about, to look your best at all times. Another important, though, aspect of aging gracefully is the reduction of stress. And there are so many ways that we as women are stressed in our life, and we have to, number one, first identify them, because sometimes we don't realize that we're getting stressed in a specific environment.
That's correct, Dr. Bachamann. And I really like the topic that we are discussing today, aging gracefully, and especially in South Asian community. Once you cross, say, 50 or 60 or 70, then you fall into a certain group where there are certain norms and cultural practices. And here your topic is bringing this new revolutionary idea that age is just a number and you need to enjoy every day of life. And I think by talking about stress and aging, we really need to understand stress can be in many, many forms. So how is it impacting aging, and what you have found? So our viewers are really looking at this episode. What can I do? Because I want to look beautiful and I want to enjoy everything in my life, even though I'm 90. And you just gave an example of a 90-year-old. So I'm all ears, and our viewers are also all ears to hear talk about stress and why reducing stress is so important when we are aging.
Well, the first key to what you just said, Varsha, is identifying your stressors. And one, and this is just one, we could talk about many, but one of them is, how well do we sleep at night? Are we stressed because we're thinking of what has happened during the day? Are we thinking about what we have to do tomorrow? And we really have to have, each one of us, a switch that we can turn off. For me, one of the best ways to turn off the day is to read a funny book. I can't read a book that is serious or a book that has a deep message. I need something that's very light, that's very funny. So that's my switch to turn off the day. But another issue that many women face that interrupts their sleep and causes a lot of stress is they get up frequently during the night. And actually, I'd like for Juana to comment on the issue of bathrooms times. How many times do you wake up to go to the bathroom during the night? And that really can interfere with your sleep if you're up at 11 o'clock, at 1 o'clock in the morning, at 3. Is that a common problem that you hear, Juana?
Yeah.
So yes, in my practice, that's very commonly seen. As of course, I'm a urogynecologist, specialize in pelvic medicine. So this is something I see and treat often. But you can see that lack of sleep will cause stress and vice versa. Now, lack of sleep commonly in this age group that you have outlined include some of the problems with pelvic health. It could be overactive bladder or having to get up every hour. No one can sleep with that frequency. There's no restful sleep that is required. But also, this lack of sleep and stress carries over to the daytime, where you cannot function because you're tired. You need to sleep. And sleep is really important for health, because the abnormal hormones would be increased at night if you're not sleeping well. So it coincides and comes together with a lot of things we do and see and need to take care of.
I totally agree with you, Dr. Hutchinson Coles, because if I did not get sleep for one night, I cannot function next day. And I completely agree that sleeplessness can be a real stressor that can play an important role in anyone's life. And especially going to bathroom every night. I don't know how many women are actually keeping a diary or correlating it with their lack of sleep or lethargy or tiredness. So Dr. Bachamann talked about stress, and you talked about sleep, which is disturbed due to frequency of urination. What is your observation in women that you are meeting every day, and how do you address this factor in them?
Regarding lack of sleep, there are many ways to approach this. Of course, I need to speak with the individual as to what are the specifics regarding what's causing for them not to sleep. However, some simple strategies would be to be careful in what and how much and when you drink before going to bed. You know, if it's caffeinated beverages, we need to decrease caffeinated beverages because it's a diuretic. You're going to be producing more urine and need to get up, right? Certain habits during the day, if your food content is filled with salt or sodium, you will retain water. And then at night, when you lie down, there is a better distribution and more urine is produced. So simple things like watching what you eat during the day, in addition, will decrease the amount of urine produced and maybe decrease the frequency of having to get up to urinate at night.
Thank you so much, Dr. Hutchinson Coles. This is a great advice for many who might be watching this show right now and experiencing the same kind of symptoms that you just described. And aging gracefully has a lot to do, not just with the stress and the sleep, but there are many other factors. And I wanted to ask another factor, which is what you eat really matters, the diet. So if you can throw some light on what is the impact of balanced diet on aging?
Well, let me start that because I think that sometimes, even for myself, it's confusing because each one of us has different food tastes, and what I may like, my family may not like. But I think that the real bottom line is variety, that you really have to bring your vegetables into, your life, that you have to have protein in your life. For so many women, if they're not taking a supplement, making sure that you have calcium-rich foods, because that is clearly important for bone health. And we don't have to discuss that at length right now, but to age gracefully, posture and bone strength are very important. I know that all of us have had family members where we see that they lose 3 to 4 inches because, number one, their bones get thinner, and one of the causes is insufficient calcium. So I like to have a chart every day, almost like the My Plate, that says, have I gotten enough vegetables? Have I gotten enough protein? Have I had enough calcium, or do I need enough or do I have to take a supplement so that I'm getting the calcium I need? So it's really important. And we can't just say, well, I eat what I have, but rather make sure that we shop and we get what we need and we get variety. Do we need a lot of sugary foods? No. They're good to eat, but we don't need that many. As Dr. Hutchinson Coles says, we don't need a lot of salty foods. Mm-hmm. Fruit juices are not good. That it's been shown that if you're going to eat an orange, yes. If you're going to drink orange juice, no. That you need that fiber. You need the entire orange, not just the juice. These are just a few of the things that I talk to my patients about. that
Mhm.
sure you get variety, but you don't need a lot of sugar. You don't need a lot of starch. You don't need a lot of bread-based products or cracker-based products.
So, Dr. Backman, I have a question about when you're talking about the food and the diet. When you talk to your patient, do you recommend that as we are approaching and we are using patient-centered medicine? So, what would be your recommendation for all these patients that how significant or how important it is to have at least one appointment or consultation with their diet consultant or nutritional specialist?
Clearly, it's important for those that have weight issues. So that's the number one, that one does not want to be either too thin or too overweight. So body mass index, which looks at how tall you are in relation to how much you weigh, is very important. And that's the first reason that you would talk to someone, a nutritionist, a dietitian. The second is if you're not eating well and you know it, that you crave the muffins, you crave the cookies, you crave the sweets, and you're not getting everything that you should be, well, then having someone advise you as to what can you substitute for these other treats is clearly important. And the third is if you've been found to have a problem, such as your blood sugar level is high, or the fats in your blood, the lipids are high, and you're at risk for cardiovascular disease, heart attack, stroke, then you also want to talk to a dietitian to see what should I be eating and how can, with the help of medications, if those are advised, how can I control my blood sugar level? How can I control the fats in my blood? So these are really key. And I think the fourth is if a family member has problems, it's a family affair. So to age gracefully, you have to age gracefully with a supportive family, with a healthy family. And if there's family members who have dietary issues, being part of the solution, going also with the family for this type of counseling, I think is clearly important.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్ నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
We really need it's understood that someone who is at that age, they may not be preparing their meals on their own, and the family members might be preparing for them, and it's really important to have a buy-in by the family members so that everyone is understanding what diet this aging person is receiving and how all the nutrition requirements are met. So when I'm talking about eating, we always drink when we eat. So I wanted to ask Dr. Hutchinson Coles about the hydration part of it, being a urologist, urogynecologist, and now she's treating women who drink a lot of fluids and then they have urinary frequency. So how would you balance that hydration part?
Well, Hydration is important because we are 60% water. And so that is so important. And in addition, I must go back and add that during our aging process, we require a lot more fiber and approximately 35 grams of fiber per day. And just tapping into Dr. Bachmann's statement about a nutritionist, it's hard to quantitate that much without someone particularly guiding you as what is 35 grams. But with that degree of fiber, you do need to consume enough water to allow that process to cause or result in easy evacuation. Talking about also supplements with the appropriate fiber content, water, and a magnesium supplement, you'll find that evacuation, bowel evacuation, is a lot easier. That will also cause a lot of digestive comfort when bowel evacuation is easy and prevent some of the pelvic floor problems that I see and treat.
Thank you, Dr. Hutchinson Coles. I think it really makes a great sense that if we eat well, if we drink well, that means appropriately, everything in balance, then it will reflect on ourselves, on our skin, on our attitude, and how we feel overall, the energy level. So there are more than just reduction of stress and sleeping well and eating right and drinking right. There are many more other factors that really impacts how we age. And putting graceful next to it is also how we look, how we appear, how we interact with other people, and how is our self-confidence, even at 90. So what are those other peripheral factors which incorporates the mind, body, everything in one kind of a comprehensive concept?
We have to protect the mind, and the mind helps us for many reasons. So mindfulness and meditation is an important part of even helping to handle stress, right? So we really have to teach and learn about how to achieve those moments or those peaceful times to help to regenerate or mind or thoughts, and certainly manage stress.
Thank you, Dr. Hutchinson. Dr. Bachamann, I will reach out to you to ask you about how do you advise your patients about learning something new?
Okay, well, the first thing I'm going to talk about is learning something old.
Uh-huh.
Learning something old is, we all know that it's so important to do preventive health. So what does that mean? It means that we have to get over our fear to have the mammogram that we need, to have the blood pressure check that we need, to have the examination that we need, that if we are one of those women who's getting up every 2 hours to use the bathroom, it means that we have to be preventive, that we have to go see Dr. Hutchinson or another doctor who cares for bladder in your area, because that's the key, that one has to be preventive, that you can't just say, well, you know what, I'll sit back and if the problem happens, I'll take care of the problem. Because sometimes when the problem happens, it's a lot more difficult and it will interfere with your aging gracefully. But it's truly important to follow all of the preventive health measures. It's almost like what we were talking about with seeing a dietitian or a nutritionist, that's preventive, that we're doing that because we want to stay healthy. We want to age gracefully. And making sure that we see our healthcare provider, whether it's for our feet, for the podiatrist, whether it's for our heart, whether it's for our bladder, whether it's for our pap test, that it clearly is an important aspect of what we should be doing in a positive way. So that's a positive part of who we are. And one other positive is embrace our spirituality, whether it's our religion, whether it's what we believe in, also is very powerful, that it can keep us young in spirit and keep our bodies healthy at the same time.
That's really a great tip for a lot of aging individuals, that you can learn something old. I really like that tagline that you just said. We always talk about learn something new, but well, we need to go back and learn something old as well. So thank you for sharing that. I have heard that more you learn about new hobbies, activities, it really helps your body and brain both to adapt and open up a new neural connection. So can you talk a little bit more about moving often? Now I'm jumping from, I would say, mind to a bodily adaptation as you are aging. So what would you say about moving often? What does it mean?
Moving often will help you to connect with your balance, for sure. If you're not moving often, getting your muscles active, stretched, and strengthened, you won't have the baseline to be strong and flexible and balanced. And that is an important part of aging, to remain and maintain flexibility and balance. If you are immobile, the joints won't work the same way. And you can even develop contractures. Some people medically can't move, but if you have the ability and someone to guide you and assist you, movement is very important. That's what joints are meant to do. And part of that will help to strengthen muscle activity so you can function a little longer in the body that you have. And that's really also critical.
And I'd like to add to that, that when you don't have balance, some people will say, well, so what? I'm not going to be an athlete when I'm, 85. But it's also balance for preventing falls. So many very active patients who I see have that fall, and they break a hip or they break a leg, and that really puts them behind because they have to get that fixed. They may be in the hospital for a long period of time or in rehab for a long period of time. So it's not just, when we talk about exercise, it's not just exercise for our cardiovascular, for our muscles, for our flexibility, but also to protect us from some of the adverse things that can happen if we don't have good, balance, good flexibility. So it truly is very important to make sure that you do something every day to try to maintain your muscle strength, to maintain your balance, to maintain the symmetry of your body, so that you can withstand, if someone accidentally pushes you, that you won't fall in a way that you will have a serious injury, especially one to your bone.
Thank you, Dr. Bachamann. I think I have heard move it or lose it, which is really an important factor for everyone. And considering our population today, most of our aging population, they are all nuclear families. We do not have many joint families. For South Asians, yes, we do have families who live with their aging parents, but most of the young children, they are at work and children are in school. So the aging parents are still at home, and they really need to understand this, that if they continue to move, they will be able to take care of themselves independently. So if you sit for longer hours, I believe that you're going to lose it. So you get up and move, you will keep it. And all this agility, which is in form of either physical activity or yoga or Tai Chi, there are a variety of ways aging adults can engage. Swimming, which is also considered as very good part of activity, and biking if you can do it. I have heard stories about 76-year-old man, 76-year-old man running marathon, and 90-year-old swimming. So it's all doable physical activities under the right guidance and right direction. And that's what is going to help them age gracefully. Am I correct?
Yes.
So as a conclusion, when we talk about aging gracefully, it applies not just to the elderly. I would say it applies to everyone, whether they are in 20s or 30s or 40s, because we all are aging. As I would say, a species like Homo sapiens, nobody is not aging, correct?
Right.
So we all are aging, and we all need these tips to incorporate in our life so that we all are aging gracefully. So I would really like some conclusion remarks from you as well as from Dr. Hutchinson Coles, so that this is like take-home message for all our viewers.
So aging is a natural process. Everyone will age. And how we negotiate that process is going to help to determine how we live our lives at the older age, right? So we want to be able to move. We want to be able to function independently as much as you can, even with families in our lives to assist us. And the better you age, it's the better you can enjoy your children and grandchildren and be able to impart some of the culture, the activities, and enjoy the pleasures that comes with that activity. And so it's not too early to engage in some of the activities or some of the habits that will result in healthy aging. It doesn't happen by accident. Yes, we know genetics play an important role, but you have to also work with what you're given. And so be careful what you eat, be careful how you use your mind, be careful how you use your body, and hopefully you'll have the successful aging and the graceful aging that we desire.
Thank you, Dr. Hutchinson Coles.
And I'll just add one other thing, and that is when we started, we said age is just a number. But I'm going to promote age is something that one should be proud of. And I started with my 90-year-old patient, and I will end with her, because when she goes to family events, when she goes to whatever gathering she goes to, she said so many women are afraid to say their age because they may be labeled as old. She said, but I want age, that I'm 90, I want age to be something that I'm wearing as a badge of I've had a good life, I'm 90 years old, and it's something that to be proud of. So we should be proud of the age that we're at, regardless of whether it's 40, 50, 60, 70, 80, 90, or 100, and embrace it.
Thank you so much, Dr. Bachamann and Dr. Hutchinson Coles. This gives really a great, powerful message to all of our viewers. And to summarize what you have shared with us, age is just a number, right? And we all need to age gracefully by doing everything that Dr. Bachamann and Dr. Hutchinson said in this episode. Number one, watch what you eat, watch what you drink. Follow all your guidelines for your screening. If you have to see your physician, please see your physician, primary provider, your healthcare provider on time. Get your screenings done. Get a check that yes, my mammogram is fine, my chest x-ray is done, I have got my immunization. Make your appointment with your dietitian and make sure that you are eating the right food. And while doing all this, make sure you are moving and meditating. So I think I summarized what you have advised, and I hope our viewers will implement this in their life and age gracefully. So my viewers on Healthline for TVASIA Telugu channel. It's really my pleasure to have Dr. Bachamann and Dr. Hutchinson here in this episode. And I thank them for their time and their expertise and their valuable advices and information that they shared with us. I hope that you will take this advice and you will use it in your own life and continue to age gracefully. For now, I'm saying bye, your host Varsha Singh, but I will be back again with another group of specialists, a panel of specialists, and on this Sati series, we will have some more Sati physicians who will share their expertise with you. So thank you, Dr. Bachamann, and thank you, Dr. Hutchinson. I appreciate your time. So saying bye for now, and I'll see you next time. So don't miss next episode. See you soon. Saying bye for now for Healthline TVASIA Telugu channel. This is Varsha Singh. See you again.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.